The FDA says there is currently a nationwide shortage of Adderall, which is a medication used to treat attention deficit hyperactivity disorder in children and in adults. This morning, we have a live interview with Dr. Shane Scott with the Internal Medicine and Pediatric Clinic of New Albany. Good morning, Dr. Scott. Thank you so much for joining us.
Hey, good morning.
So what have you heard, if anything, about local patients maybe having trouble getting their Adderall prescriptions refilled because of the shortage?
Yeah, we are getting several calls at the office with families not going to the typical pharmacy that they use, not able to get the medication. The one that we're getting the most calls about is the extended release Adderall, the 20 milligram. So it is an issue here in North Mississippi as well.
And how might this current Adderall supply level change in the coming weeks or months?
Well, there is one major manufacturer of Adderall in the United States, other smaller companies as well, but the major manufacturer says hopefully within a couple of 3 weeks this will be improved. And it's likely with kids starting back to school, obviously there was an increase in the need for Adderall. Some parents may have taken their children off of that for the summer, and so everyone getting it refilled at the same time probably exacerbated their supply chain issues.
Yeah, we have talked about Teva for a couple of weeks now as we talk about the Adderall shortage. What would you recommend people do if their pharmacies lack the needed supply to refill those prescriptions?
We found the most success with asking patients and their families to call local pharmacies. We found that a lot of the big box stores or the people who have been unable to get the supply readily. And the local pharmacies, the mom and pop pharmacies, are not tied to just one distributor. So they can tap into several distribution systems and order those medications. So when we get calls that someone's out of the medicine, we'll ask the patient to call a local pharmacy in their neighborhood and see if they have it. The thing that we have to be worried about there is, as physicians and providers who prescribe controlled medications, the state keeps up with what pharmacies you've gone to. And so if you're going to several different pharmacies trying to find the medication, it does show up on a record with the state. And so sometimes that can be frowned upon if you're going to numerous pharmacies trying to get medications and getting it filled different places every month. So I would encourage people to find a hometown pharmacy that they believe will be able to supply the medicine for the foreseeable future and stick to that pharmacy.
That's very informative and interesting. Now, what kinds of health impacts could patients potentially experience, if they're unable to get these Adderall prescriptions filled? It is for an important cause, for their attention.
Well, obviously, with us finishing 9 weeks, we were fixing to go into the last block of school before Christmas. We may see changes in grades, concentration, and focus. And if the kids are on and off medications, sometimes they can have more side effects like headaches, belly pain, sleeping problems, especially if parents are having to ration the medication.
Yeah. And one more question. Do you see people, I guess, they hear about these that happened with the formula shortage. Do you see people going to get more of it in, I guess, because they're worried about a shortage of that prescription?
Yeah, that's not possible because
right.
the prescription is written for a certain supply, and the patients cannot pick up any more until that supply is gone. So if the prescription is written for 30 days, then it's at least 30 days. On that 31st day is when you can pick up a new prescription. So patients can't stockpile the medication as they could a formula. It's state law, federal law.
Well, thank you so much, Dr. Scott, for joining us. Of course, this is Dr. Scott joining us from Internal Medicine and Pediatric Clinic in New Albany. We do appreciate your time and talking to us in such an important manner right now.
Thank you.